good afternoon, and welcome to today's series, Community Connections, your bridge to resources. Today's topic is slips, trips, and fall prevention. We're really excited to have everybody on the line today and look forward to sharing some great resources on how to avoid slips, trips, and falls. Our presenter today is Ms. Karen Dessy. She's a clinical educator with Community Hospice, and as always, just a great resource providing us information on various topics. So Karen, we're really excited to have you join us today. Thank you again for taking time out of your busy day. I'm going to let you share a little bit more about yourself, but do want to remind everybody that this presentation is being recorded and will be available on the Community Hospice YouTube channel. So if you missed something, don't worry, you'll be able to go back and rewatch the information or share it with all your friends and family as well. So with that, I'm going to go ahead and pass it over to you and let you take it from there. Thank you so much, Karen.
Thank you, Kristen, so much. Hello, everybody. We've met a few times. I'm Karen Dessy. I am the clinical educator here at Community Hospice. It's always a pleasure to do some of these presentations and provide you with resources and some education. So today we're doing slips, trips, and falls, and we're really talking about prevention, because this is what it looks like when we slip and trip and fall. I don't know about you guys, but I'm getting older and I find that my balance is not always great, and I tend to have a few more falls than I care to admit. So some statistics for you guys. 1/3 of seniors 65 years and older fall each year, and then 1/3 of nursing home admissions are due to those particular types of falls. We have 60% of falls in the home, 30% of falls in public areas, especially when we're shopping or when the weather is wet. Sometimes just tripping over the threshold a little bit because we're changing from one kind of surface to another kind of surface, and so that can be really tricky at times. And 10% of falls in healthcare facilities. And just a reminder, I'm all about interaction. So if you have questions, thoughts, concerns, something to contribute, please feel free to interrupt at any moment in time. Okay, put your questions or concerns in your chat box, and I'm happy to answer them as we go through. In 2000, direct costs for seniors was about $20.2 billion. And then indirect costs like disability, productivity that went down, the quality of life, the loss of independence, and all of the things that come along with that. Those also, contribute to our lifestyle, the way that we are able to live when we have situations where we're no longer working and having to go and see a physician and get treatment and therapy. That definitely takes a toll on our finances as well. Estimated costs of a fall-related injury by 2002, or this is old, obviously, will be like 32.4 billion. And I believe the last research that we had done was just about 35. Traditional risk factors and the categories fall into intrinsic, modifiable, extrinsic, and non-modifiable. So intrinsic are things like medical conditions, lifestyle choices, and our cognition, how alert-oriented we are, how often we are confused. Is it due to the medication? Is it due to our lifestyle? These are things that we can maybe adjust or change. Extrinsic is internal and external environments, right? Our personal internal and external environment, as well as our physical external and internal environments as well. So the way that our homes are, if we have a lot of rugs, that kind of stuff. Some modifiable factors are risks factors that you can change. So if you have lots of throw rugs in your home, those are things that can cause a lot of trips, slips, and falls. So those are things that we can modify by removing them or changing the direction that they happen to be in. Coffee tables can be moved, giving us a little bit more right away, so to speak. And the non-modifiable risk factors are things that we really can't change, right? Things that are, if we have had an issue and we've got a broken hip, that's not a modifiable thing. Something that we can maybe work towards, but it's not something that we can necessarily fix. If something is not removable, that is something that you would not be able to modify. So just to give you a little idea of what that looks like. So some things that we can do to prevent falls. We can begin exercise programs. We can have our vision checked. We can certainly make sure that we see our healthcare provider and review our medications if we are taking medications frequently. At least go to our annual healthcare checks, and then absolutely we can make our homes safer. And we'll talk a little bit more about that as we go on. So what's with the lack of, what's with the exercise programs, and why do I bring that up? Because whether we're young or whether we're old, depending on wherever we happen to be in our life, a lack of exercise leads to weakness and increases our chances of falling. It depletes our core strength, right? We're always talking, everyone's always talking about our core strength, our posture, the way we walk, the way we stand, what keeps us upright. And if we're not strengthening those muscles frequently, then our posture and our core strength depletes, and that can take some of the strength from our legs and our extremities, and we can have a fall based on that. Exercise definitely makes you stronger and can also help us to feel better. So if it's a cognition issue that we're having when we're feeling extra tired, definitely exercise will perk you up and get good circulation going so that we can absolutely feel better. Exercises that we do can improve balance and coordination, like Tai Chi and yoga are very helpful. And then, of course, we always want to ask our doctor or healthcare provider about the best type of exercise program for each and every individual. We all have different types of bodies. We all have a past history of some nature or another. So if we've injured our back or our shoulder or knee in the past, we want to make sure that we are doing the correct exercises for our body and any injury that we may have, or to prevent any injuries in the future. One of the things that can be a real problem for us is our vision. Definitely for myself, as I'm getting older, I am noticing that my vision is a little weaker than I care for it to be. I don't have to wear glasses all of the time, but it definitely helps, especially at dusk time. So getting your vision checked frequently, they recommend your vision to be checked at least annually now, where, most of our insurance programs, 2 times a year, or you can change your glasses or whatever. But make sure that you're getting regular checkups at your ophthalmologist or optometrist. And you may want to make sure that your prescription is as up to date as possible. If we're wearing the wrong types of glasses, sometimes we think that our vision changes are easily fixed by just reading glasses, but that might not be quite enough. It may work for close or far reading issues, but it may not necessarily really help with our depth perception. And there may be other medical conditions such as glaucoma or cataracts that also limit our vision. And so these frequent checkups will definitely address anything that comes up as far as medically is concerned. Have your healthcare provider review your medications. Okay, when your doctor or your pharmacist gives you your medication, always listen to the instructions that they give to you, but definitely have them, even though you may have been taking this medication for a long period of time, the longer the medication is out, more research is done, and there may be other side effects that you may or may not be aware of. So always have your pharmacist or your physician discuss with you what the possible side effects are and get the accurate instructions on how to take it, because some medications can make you feel dizzy or sleepy or throw you off balance. And so then that can definitely add to the risk of falls. Making your home safer. For those of us who need it, definitely have some grab bars, put it next to your toilet or your tub or your shower. It just makes it easier when you've got a little additional support. Please remove small throw rugs or use double-sided tape to keep the rugs from slipping, because um, if you're walking around at night or you happen to be wearing a particular type of shoe, that rug can slip right up and it can cause you to trip and fall. Wearing shoes both inside and outside the house, avoid going barefoot, and wearing slippers. Because slip-ons are slippers and they can slip off your feet, and so that's another fall risk as well. When we're removing things, you can absolutely trip over like papers, books, clothing, shoes from stairs. We won't talk about Legos that we've stepped on and tripped over. And sometimes, especially when we don't turn on the light, which is a big deal, I have stubbed my toe more times than I care to admit on the frame of my bed. And that can, that's a trip that can lead to a fall, and it can, throw you off balance and make things really difficult. Keeping items that you use often in cabinets where you can reach them, or if you really have to use a step stool if things are out of your reach, because it's just a safer way to grab things. We don't always like to take the extra step because we feel like we should be able to reach and it should be easy enough, but that's an easy way to injure yourself, causing you to go off balance, causing you to have the fall. So, we want to prevent any of these issues as much as we can. Definitely use a non-slip mat in the bathtub and in the shower floors. Talking about lighting, improve your lighting in your home as you get older. You need brighter lights to see well. Hang well-lit heavy curtains or shades to prevent the glare from windows, and definitely, especially now with the LED lights that we have in the cars, the lights are so much brighter. So make sure that if you do wear glasses, that you get something that will have a glare protection for you when you're driving, because it's just a safety issue. Doesn't have a lot to do with slip, trips, and falls, but definitely a safety issue. So how can we prevent slip, trips, and falls? Well, know your limits. Like we were talking about, if you have items in a cabinet that are too high for you, use a step stool rather than trying to stand on tiptoe, or just, don't talk about some people that jump just a little bit to pull something forward. Safety first, right? Stay active. The more active you are, a body in motion is always in motion. When we start to slow down, our muscles start to contract, they get sore, our bodies don't want to move and stretch the way that we need to. And so when you first start to strengthen or exercise, or start doing yoga or Tai Chi, you might find yourself stiffer than you normally are. But I promise you, as you keep working through those, you will feel more limber and much more flexible and gain a lot of strength. Definitely use assisted devices as needed. So if you need a walker, use your walker. It's irritating and you don't want to often, but it's a good support, and it really will make you feel safer. And we adjust, right? We're all able to make those changes one step at a time. A cane, seat lifters, whatever it is you need. I definitely find that most of my cars that I drive, the seats are lower than I prefer. And even when I raise them, it doesn't quite raise the seat the way that I want to. So I use a seat lifter in my car. Again, not slip, trips, and falls, but it's definitely something that helps. Definitely exercise and medication review. Personal safety and awareness. Please be alert and safe. Often when we are walking in our neighborhoods or when we're going to the same stores, we feel safe. It's the environment that we're used to, and we don't always look around and make sure that there's no puddles that we're stepping in, or that there's not a pothole that might trip us up, or that the people around us are people that we just want to be aware that there are people standing over here and over there, and what the lighting looks like, and be mindful of where we parked our cars. So we'll talk a little bit about those things. Personal safety begins with awareness. Awareness begins with a clear understanding of one's attitudes, values, self-esteem, personal strengths, and limitations. So we are going to address home security, personal security. We're going to talk a little bit about scams, practicing street smarts, learning to diffuse hostility, and knowing your destination. 3 steps to getting prepared. Know the risks, make a plan, and get emergency supplies. Okay, know the risks. Boy, doesn't this look terrible? The consequences of emergencies can be similar, but knowing the risks in your region can definitely help you to be better prepared. So knowing the area that you live in, are you most likely to have a flood, an earthquake, a tornado? Are you somewhere where there is going to be hurricanes? Knowing those kinds of things really are going to help you to be better prepared for whatever emergency might pop up. Okay, so once you know what you're possibly at risk of, we want to make a kit. We want to have a plan, and so we're going to prepare a kit. If you're not prepared, if you don't have a plan, and so we want to make sure that we want to have a plan, make a photocopy of that plan so you've got it in several different places, and that you're sharing it with your family, friends, and your neighbors. Keep copies of your own plan in a safe place, somewhere that you're going to not forget that you put it there. We want to get a kit, make a plan, and then inform people around us so that it happens more often than we care to in this day and age, but if we happen to be missing for a couple of days, somebody knows how to get a hold of you and where you could possibly be. Here's how we make a plan. We want to think about the emergency exits. We want to designate family meeting areas. Look for and plan for and educate each person on escape routes from the neighborhood. Ensure help for people with disabilities. If you know people that have disabilities that are going to need additional help, you want to make sure that you've helped provide that to them and that you're able to support them, or that they have some resources that they can call should they need that help. You can always notify your county and they will be able to help prepare for that, help prepare people with disabilities for that particular emergency. The location of pet-friendly shelters and hotels, right? Because if you have pets, you certainly don't want to leave them behind, and you don't want to leave them in the car if you find shelter for yourself, but they're not pet-friendly. Always have extra pet food and water in your emergency kits if you have pets. Or if you just want to be nice to somebody else's pet that might need help. Make a copy of your shot records. That was always important if you're going out of your neighborhood or out of the area that you will be in, so that if you do need to go somewhere else, you have proof. And then think about, how will you transport your pets? Do you have enough room in your car? If you're packing up your little kits for emergencies and you're going to have additional stuff in there, how are you going to get your pets to where you need to go? Choose an out-of-town contact person. Always to make an additional list of people that you can reach out to, contact, that are not going to be involved in the emergency where you are located, because chances are the power is going to be out and their phones may not be working. Make arrangements through friends and family. Make arrangements through friends and families. Practice your plan once a month. Just play it out, see how it works. Makes things so much smoother. Kind of like when you're pregnant and you're going to have a baby and you're planning on, how's this going to work? Well, who's going to grab my little go bag? Who's going to be at the car? Which hospital are we going to? Which route would we take if one of the roads were closed? It's the same thing for your emergency plan. And then, just as we said, review your plan once a year to make sure, because new roads open up, things get closed down, a new clinic, a new hospital, a new route might be available. And so we want to make sure that it's as up to date as possible. Any questions, thoughts, or concerns, guys? Okay, moving on. Step 3, get your emergency supplies. Simple little things. First, get an aid kit, right? First aid kit. Make sure you have some water that will last you at least 72 hours. Have a flashlight with extra batteries, battery operated radio with additional batteries as well for that. Non-perishable foods, dried food, canned foods, anything that you don't have to work too hard at having to refrigerate or needing to be heated. Hand-operated can opener is always helpful because you're not going to have a place to plug it in necessarily. Over-the-counter medications, antibacterial ointments, aspirin, Advil, anything for cut scrapes and splinters that you might need. List of all your prescriptions. Some matches so you can light a fire if needed. Face masks, certainly in this day and age. Clothing and blankets and pet supplies. Wow, whizzed right through that. Came right to the end of that. Any questions? Anybody? Okay, well, we thank you so much for joining. We'll be here for a few more minutes. So if you think of anything and you have anything to say, please do not hesitate to pipe in. Okay, thank you so much.
Wonderful. Thank you so much, Karen, for the great information and resources. We really appreciate, again, you taking the time to work with us today. At this time, can you just move your slide for me one?
Absolutely.
So this session is going to wrap it up for us for the 2021 year calendar. And we are excited to offer a new series starting in January of 2022. So please make sure to check the Hospice Heart website at hospiceheart.org in December for our upcoming calendar for the next year. If you have any questions or need any additional resources, please don't hesitate to reach out to us. And again, we're so grateful that you joined us today. We hope you have a happy holiday, and we'll leave it at that. Thank you so much, Karen. Everybody take care.
Bye.
Bye-bye.